On this Thursday night, gearing up for debate. What's at stake in the English language leaders debate tonight? Under pressure, Alberta's plan to ease the strain on hospitals as COVID-19 cases soar.
Surgeries, even if they're non-critical, they are important.
The patients left in limbo. And the need for more family doctors. I talked to one physician about what drew him to a small town.
You get to know your patients, you get really meaningful relationships.
Plus, taking flight.
This was the rocket ship of the day.
How the inventor of the telephone helped Canada fly into the era of flight right here in Baddeck, Nova Scotia.
Global National with Donna Friesen.
We are in Baddeck on Cape Breton Island, Nova Scotia tonight, nestled on the shore of the Brador Lake. Baddeck is described as the beginning and the end of the world-famous and stunning Cabot Trail, and a place where the Mi'kmaq have lived for thousands of years. Good evening and thanks for joining us. It's not just a stunning part of the country. The politics here in Nova Scotia will play a role in the outcome of the federal election. Of the 11 seats in Nova Scotia, 10 were won by the Liberals in 2019. If Liberal support is softening in this election, we could see the first signs of that here in Atlantic Canada on election night. We're going to get to important issues like healthcare and housing in just a moment, but we begin with the English language leaders debate tonight. It's the only one of the campaign, and though it's high stakes for all the leaders, it's Liberal leader Justin Trudeau who has to convince Canadians he deserves a new mandate. Abigail Bimman is outside the debate venue in Gatineau, Quebec. Abigail, what will you be watching for?
Well, Donna, I think the number one thing to watch for is some more debate between these two front runners who are so neck and neck in the polls. Justin Trudeau, as you mentioned, and of course Conservative leader Erin O'Toole. I think a lot of people will be looking for more from those two. Last night during the French debate, Bloc Québécois leader Yves-François Blanchet took up a lot of the oxygen there. It was a different audience, a different focus. You can expect that to be less relevant tonight. Also, we'll be looking to see how NDP leader Jagmeet Singh and Green Party leader Annamie Paul really try to get their elbows up, so to speak. Annamie Paul seemed almost uncomfortable in her French last night. Tonight's English audience much more important, especially in the steep uphill battle for her to win a seat in Toronto. And for Jagmeet Singh, look to see him try to carve out some more space for himself this evening.
The last of the French language debates, as you mentioned last night, what was the tone of that one?
There really didn't seem to be a standout winner. What you had were a couple of standout moments, perhaps. This was a 2-hour debate, just like tonight's will be as well. And those moments didn't really come until much later in the evening. I'm going to share one of them with you. This was an exchange between Trudeau and Blanchet, where Trudeau is defending himself about being a real Quebecer. And it's noteworthy because it really depicts a new tone that we've seen from Trudeau over the past couple of days. I think the best adjective to describe would be fiery. We've seen this from him on a number of fronts. Have a listen.
You keep forgetting, I'm a Quebecer. I'm a proud Quebecer. I've always been a Quebecer. I will always be a Quebecer. And I will always have a say in what happens in Quebec. You do not have a monopoly over Quebec.
Now, in terms of timing and where we go from here, there's long been this idea that Canadians, aren't paying attention to this campaign until after Labor Day. That's what we've heard. Well, here we are after Labor Day. This is debate week. Tomorrow, advanced polls open. So whether or not that sentiment is true, what is true is that we're in the home stretch here, less than 2 weeks to go, which means that the runway is shortening for leaders to show both themselves to Canadians and explain their policies. I'd also like to note that our new exclusive polling from Ipsos for Global News highlights a staggering number that 68% of respondents don't feel that a pandemic is a time to hold an election. That includes about half of the undecided voters who were polled, and the pressure there really falls to Liberal leader Justin Trudeau, who has to convince these voters that not only is an election justified and that they should go to the polls, but also that they should hand him his job back. Donna?
All right, Abigail Bimman in Gatineau, Quebec, thanks. You can watch the debate on Global at 9 p.m. Eastern and on our website at globalnews.ca. You can also listen on Global News Radio. Maxime Bernier did not qualify to take part in the official debates. Today, his People's Party of Canada said it has removed one of its riding association presidents from his post over allegations he threw gravel at Liberal leader Justin Trudeau. Shane Marshall was president of the party's Elgin-Middlesex-London riding. He's accused of throwing gravel during a Liberal campaign event on Monday. The Canadian Anti-Hate Network has linked Marshall to white nationalists and anti-lockdown content online. Well, COVID-19 is still with us, and the fourth wave is having a major impact, especially in the West. The rate of active cases in Saskatchewan in the last 14 days is now the highest in the country. And in Alberta, the strain on the healthcare system keeps growing. In Calgary, all elective surgeries and many outpatient procedures have been put on hold for the rest of the week. There are not enough beds or staff. 9 more Albertans have died of COVID-19 in the last 24 hours. Doctors saw this coming, and as Heather Yourex-West explains, frustrated patients are asking why more wasn't done to prevent it.
Laura Restrepo is used to going under the knife. The Calgary teen has had 9 surgeries in 7 years to remove tumors caused by a rare genetic disease. She was supposed to have surgery again this week.
It was scheduled for yesterday, and they called me 2 days ago in the afternoon to cancel. So that was very upsetting for everyone.
I literally cried. I was frustrated, and I don't know where to turn anymore.
Annie Claire LePage is waiting for a hysterectomy. The pain of stage 4 endometriosis is so bad now, it's often causing her to miss work. But her surgery is cancelled too. The cancellations come as Alberta's health system grapples to care for a surge in COVID-19 hospital admissions.
I'm willing to come here day after day after day.
Many in the medical community began warning weeks ago that this day would come. Alberta opened fully in early July, but it was only last week that the government reinstated a province-wide mask mandate. The unvaccinated still numerous enough to allow COVID-19 and the Delta variant to spread. For brain cancer patient Eric Mulder, that now means his treatment has been delayed.
The longer the waits, the bigger the chance that it progresses further to a point where it's virtually untreatable.
The situation in Alberta hospitals is unlikely to improve anytime soon. The province's $100 vaccine incentive program announced last Friday has so far only led to a modest increase in appointments, and there are no signs that the fourth wave here has reached its peak. Donna?
Right, Heather Yourex-West, thanks. In the U.S., where hospitals in multiple states are overwhelmed, President Joe Biden says his patience is wearing thin. He has announced tough new measures to get more Americans vaccinated. It includes a plan for a vaccine mandate or testing at all large employers and all government workers. Jackson Proskow is with me from Washington. Jackson?
Donna, the Delta variant has upended Joe Biden's plans to bring the pandemic under control. Cases and deaths are back at very high rates here in the United States. And so as part of a plan called Path Out of the Pandemic, the president signed an executive order Thursday making vaccination mandatory for millions of government workers. And in a move that impacts tens of millions more Americans, the Department of Labor will require companies with 100 or more employees to mandate vaccination or regular on-the-job testing.
My message to unvaccinated Americans is this: what more is there to wait for? What more do you need to see? We've been patient, but our patience is wearing thin, and your refusal has cost all of us.
Now, the more immediate threat may be around children and COVID as school returns. In just the last week, 250,000 students in the U.S. have contracted the virus. 55,000 students have been hospitalized in the last few weeks. And in Miami, 13 staff and teachers in just one school district have died within the last month. The president is asking all schools to set up regular testing programs. There's a double urgency here for Biden because not only is COVID straining hospitals, but Biden's approval rating for his handling of the pandemic has fallen sharply. Donna?
All right, Jackson in Washington, thank you. Well, 18 months ago this week, Canada recorded its first COVID-19 death, a resident in long-term care. And since then, thousands of residents in LTCs have died from COVID-19. Much was made of how the virus exposed huge weaknesses, from low staff-to-resident ratios and poor pay. Lots of political leaders pledged to change things. So what's happened? Jamie Mauracher is looking into that.
I still have nightmares. I still can hear the people's cries.
Inside this Winnipeg long-term care home, Eddie Callisto Tavares says she witnessed horrors that will never leave her.
My fear was that every time I stepped outside of my dad's room was what's happening to all the other residents.
Seniors, she says, were locked in their rooms, ignored, terrified. Her only comfort, caring for her father, Manuel Callisto, in his final moments. So many others, she says, were left completely alone.
It feels more like a prison than a home.
The system failed the residents who died. The system failed the residents and employees who got infected.
So far, long-term care and retirement home residents account for 56% of the country's COVID deaths, more than 15,000 people. And though the pandemic clearly exacerbated the problems in Canadian care, many issues have existed for generations.
We have actually been able to see the conditions that seniors are currently living in and have been living for the past decades.
Experts say it's time for the federal government to show leadership in the form of national standards and oversight.
The federal government does have power to look after the health of the nation. And so it could use those powers if it wanted to do that.
Justin Trudeau has promised national standards before, but another year into the pandemic, there's been no action out of Ottawa.
We're now starting to see the deaths mount again. And what it tells me is that when we haven't fundamentally fixed some of the issues, we're just going to keep seeing repeated issues of outbreaks.
Samir Sinha, a world-renowned geriatrician, has been preparing recommendations for long-term care standards, smaller settings that feel more like homes, one person per room, a ban on shared washrooms, and at least 4 hours of daily care per person. Scandinavian countries, particularly Denmark, he says, are ahead of us when it comes to compassionate, safe living spaces for seniors.
They started saying, let's do what we can to support people in their own homes for as long as possible, because that's often can be done at half the cost as what it would cost to care for somebody in a long-term care home.
In Winnipeg, 56 people died during the outbreak at Maple's personal care home. Today, new residents are being accepted again. Callisto Tavares worries we haven't done enough to avoid more unnecessary death.
This is still happening. There's still people crying out for help, and there's no one there to help.
And why the need for lasting solutions in these homes remains as urgent as ever. Jamie Mauracher, Global News, Toronto.
The high cost of housing coming up, the struggle to keep up with the demand for homes as the pandemic heats up the real estate market. There's been a real estate boom in many parts of Canada, including here in Nova Scotia. Low interest rates and so many people working from home has created huge demand. And there's a housing shortage in this province. As Ross Lord explains, that's led to some house hunting strategies that are unorthodox and ugly.
It's a fact of life in many of Canada's biggest cities: Vancouver, Toronto, Montreal. Housing demand exceeding available supply. But it's a growing reality in Halifax, too, leaving more people priced out, whether they're looking to buy or rent.
So I started out looking at different buildings, just looked them up on Google, find their website and their phone number, call them, see if they have anything, and everybody called me back and said, we got nothing.
That's how John Barrett Ogilvy ended up here, in a hotel room. His 8-month lease costs $1,300 a month, including utilities, less than what many Halifax landlords charge. There's no kitchen, but Ogilvy isn't complaining.
Concession's probably a good word. I've kind of resigned myself to it, right? Like, I was excited to finally get an apartment and look for a place of my own, and now this has kind of screwed it over, but what can you do?
To slow down runaway rent increases, Nova Scotia currently has a cap in place of 2% a year. But the new premier says he plans to remove the cap.
It's not the solution, so we really need more housing stock in this province. That's how we'll solve the housing crisis.
The price of houses has also escalated, in part from people moving to Nova Scotia during the pandemic. Some to find peace of mind, others hoping to make their dollar go further. But no such luck.
I had a property that I had 32 offers on. I mean, that's unheard of.
For young Nova Scotians, sky-high prices are a downer.
It seems that there is very limited ways or even prospect to become a homeowner.
Some blame the housing crisis for an increase in temporary homeless shelters, like this one that was forcibly removed by Halifax Regional Police last month. The problem is now spilling over into small-town Nova Scotia, where employers say housing shortages are part of the reason they can't attract enough workers.
We're currently looking at options to buy housing or to build housing. Many private businesses locally have already gone that route and have made the investment in employee housing for their businesses.
The real estate industry itself is calling for the government to waive the provincial transfer taxes, saving home buyers thousands of dollars. But there's no sign of immediate relief to make finding a decent place to live more affordable. Ross Lord, Global News, Halifax.
Still ahead, an example of the family doctor so many Canadians are searching for. One of the biggest issues for voters here in Nova Scotia and across the country is health care, in particular, access to a family doctor. The Canadian Medical Association estimates about 5 million Canadians don't have a primary care physician. That has a trickle-down effect from late diagnoses to a heavy reliance on hospital emergency departments. We went up the road from here to meet a family doctor who has found a way to make things work for people in his community.
Perfect.
You could call his approach old school.
You know, my heart's sounding good there, Michelle. Wonderful.
Dr. Michelle Chiasson is the kind of family doctor tens of thousands of Canadians long for.
You get to know your patients, you get really meaningful relationships, you get to know the grandparents, the parents, and the children, the whole families. Primary care physicians, the family doctors are, the foundation of healthcare.
Instead of a big city practice, he chose Cheticamp, an Acadian fishing village on the west coast of Cape Breton Island, Nova Scotia. Community is everything, from his role as a hockey coach to the babies he's delivered to his rounds at the long-term care home.
Olga!
His connections here are deep.
We have to cover the emergency department, we cover the hospital, we do our clinics, we do nursing home, we do the youth health center, we do home visits. We're an important resource to the community. I'm very happy to be that resource to the community.
He admits it can be daunting at times.
Sometimes, you are the one dealing with something at 3 o'clock in the morning, and there's no surgeon or specialist down the hall.
The key is collaboration. He is not alone. He's one of 4 family doctors here, supported by a team.
Nurses, family practice nurses, doctors, our OT, our physiotherapists, social worker, and we have a team that gets together and really cares for the patients. So what I really would say is to the government that they really need to focus on putting teams in place, not just trying to recruit an extra doctor here. They need to look at all these communities, big and small, and realize that medicine's changing. Now let's have a look at these thumbs here, eh?
The population is aging, the care they need more complex.
We have tons of phone calls every week from people from Sydney, from Glace Bay, from Port Hood, who would like to come to Cheticamp to see a doctor. And unfortunately, if they're not in our catchment area, we can't see them. It's nice to see you.
He's a rare breed, part of a team of family doctors offering the kind of cradle-to-grave health care Canadians expect, but that is increasingly elusive. It was here in Baddeck over a century ago that aviation history was made. That story coming up. And this is the Kidson Island Lighthouse, built in 1912. We're back from Baddeck, Nova Scotia in a moment. There's only one way to get across this great country in a day or so, and that's by airplane. It's so easy, I take it for granted, and so do our political leaders who crisscross the country campaigning. But imagine more than 100 years ago, when passenger jets were still a dream, seeing the first powered flight of a plane in Canada. Well, it happened right here in tiny Baddeck, Nova Scotia, thanks in large part to the man who also invented the telephone. Alexander Graham Bell, whose genius helped shape the modern world, adored Nova Scotia, and the stately home he built in Baddeck is still standing. Best known for inventing the telephone, he was equally obsessed with something else: flight. It was here 112 years ago that the first powered flight in Canada and the British Empire took place. It was a cold February day. Brador Lake, frozen solid, was the runway. This was the place Canada first entered the era of flight. It was called the Silver Dart, a delicate-looking contraption that had no brakes, was difficult to maneuver, and was made of steel tubing, wires, bamboo, and wood. Men on skates helped steady the wings, and Baddeck-born pilot John Alexander Douglas McCurdy gracefully took to the air.
McCurdy got inside the aircraft, and he rolled it on the ice for about maybe 500 feet. It lifted off the air, got up to about 80 feet, and flew for about 2 kilometers.
Among those watching, Alexander Graham Bell. He and his wife Mabel were passionate about flight at a time when most considered it a wild idea.
People thought Bell was a bit of a nut bar. Anybody that was involved in aviation in those days was considered a bit out to lunch.
Even before the Wright brothers had taken off at Kitty Hawk, Bell had done hundreds of experiments with kites and had assembled a team called the Aerial Experiment Association. Its aim was simple: put a man in the air. "We breathed an atmosphere of aviation from morning till night," Bell said, and almost from night to morning.
It was a fun airplane to fly.
Ed Lubitz built a replica of the Silver Dart.
This was a rocket ship of the day. I mean, this was a absolutely cutting-edge, state-of-the-art airplane. We spent a lot of time saying, well, what would a 1909 mechanical engineer know? And the answer was a lot more than you would think.
Innovations from that plane endure today, from ailerons, the hinged edges on the wings that control the roll of a plane, to the tricycle undercarriage.
You know, I'm not going to take anything away from the historic implications of the Wright brothers, but I would say to you the Silver Dart is equally as important because of the innovation and the engineering and the scientific principles they applied as well.
Quite a legacy for a small Cape Breton town. One Alexander Graham Bell loved so much, he chose it as his final resting place. And that is Global National for this Thursday. I'm Donna Friesen. We leave you tonight with some of the stunning vistas from Cape Breton Island. I'll see you on Tuesday from Quebec City as we cross the country in the countdown to the federal election. Thanks for watching. Bye-bye.